So first I want to tell you how happy I am that we're able to have our children and youth go back to in-person learning this fall. We all know how much students and families have been through because of the pandemic, and school is so much more than academics alone. We know in-person learning is key to emotional and social skill development. This school year, our routines will look similar to last year because the threat of COVID-19 remains, and in particular, the Delta variant is here. Public Health has been working together with Halton school boards every step of the way through the 2021-2022 school year planning process to ensure that we are balancing the learning needs of our students, their physical and mental health, and the safety measures required to reduce the chances of COVID-19 entering and circulating in our schools. So I'd like to start off by sharing some current COVID-19 trends in Halton Region. Halton has seen over 18,600 cases of COVID-19 so far, and these are just the ones that we know about. The orange line on the far right indicates the most recent days of data when cases are likely to be underestimated. After reaching an all-time peak in mid-April, cases have significantly declined over the summer due to the enormous vaccination campaign that has been underway, as well as enhanced public health measures. Since late July, we have started to see an increase in cases once again. Experts in Canada have confirmed we are now firmly in the fourth wave of the pandemic. As you can see in the figure above, this new wave is being driven by the Delta variant, whereas in the third wave, cases were driven by the Alpha variant. The Delta variant has increased from only 1% of cases in April of 2021 to 67% of cases in July. And the proportion of Delta cases has likely climbed higher in the last few weeks alone. There are a few reasons why this is important. First, individual protection against the Delta variant improves greatly after the second dose of the vaccine. Second, we know that the Delta variant is much more contagious, so we will need higher vaccination rates in our community than previously thought in order to protect the whole of our community. And we will also need to continue certain public health measures, such as physical distancing and masking in many settings. During the 2020-2021 school year, there were a total of 1,197 total school exposure investigations and 41 school outbreaks in Halton. With Delta as the dominant variant of the virus circulating in our community, I fully expect that there will be more student cases and exposures to come this fall. That's why it's so important to have layers of protection at our schools and within our community, including in your own homes, to ensure we are doing everything possible to reduce the spread this fall. I will talk about how we can protect each other and our schools a bit later in the presentation. Children's mental health and behavior have been negatively impacted by necessary school closures and the shift to remote learning. Young children and adolescents have been impacted differently. Based on recent data, parents of young children have reported more behavioral challenges, while adolescents were more likely to report increased anxiety and depressive symptoms. Parents in Halton have identified concerns around their children's mental health, loneliness, and isolation. These trends are seen not only here in Halton, but across Canada. Youth may be particularly vulnerable to negative effects of school closures, as school connectedness is associated with many benefits for students. Schools also serve as a key setting for mental well-being promotion and access to mental health services. In order to keep schools open this year and avoid worsening child and youth mental health outcomes, we'll need to work together. So I'll now talk about how we plan to achieve this. There are many people and organizations that have come together to develop our 2021-2022 school reopening plan in Halton, and I'm grateful for their time, cooperation, and dedication to giving our school communities a balanced plan. I'll now speak about some of the key features of this plan. When it comes to implementing appropriate public health measures, Halton Region Public Health provides guidance that aligns with Ontario's Ministry of Health. Guidance documents, as well as other important resources and links, are available on our website for school staff and parents. To start, students in grade 1 to grade 12 must wear masks indoors, including in hallways, during classes, and on school vehicles. Although the Ministry of Education encourages kindergarten students to wear a mask indoors, Halton Region is going above and beyond to ensure our children's safety. On public health recommendations, Halton schools have implemented masking for junior and senior kindergarten. Students do not need to wear masks outdoors, but distancing should happen between different cohorts outdoors as much as possible. This is being done to reduce the risk and to keep schools open. Masks may be temporarily removed indoors for eating and drinking at lunch or break times. All staff and visitors in schools must wear medical masks and should use eye protection such as face shields or goggles when working with children who are unable to wear masks consistently and correctly, or when close contact is required, such as in a kindergarten class. Staff may remove medical masks indoors when eating and drinking while maintaining at least 2 meters distance from others. In an environment where everyone is masked, eye protection is generally not required. Eye protection is required when you will come in close contact with someone unmasked. As always, reasonable exceptions for medical conditions will apply for both staff and students. All students, teachers, and school staff must continue to self-screen for COVID-19 symptoms every day before attending school or childcare, and complete the provincial school and childcare screening tool. The screening tool must be completed every day of the week, including weekends and holidays. Yes, parents, that's right. Parents and caregivers can complete the tool on behalf of a student. We are aware that the Ministry of Health is currently revising the screening tool to include a shorter list of symptoms. The intention is to have it released next week in time for school reopening. Parents, students, and staff must use the most recent version of the screening tool. A green screen, as shown here, will indicate that the student, teacher, or staff person is safe to attend school or childcare that day. If the student, teacher, or staff person does not pass the screening tool, the results will be a red screen with an X as shown. Follow the directions provided, which may include contacting the school to let them know about the result, self-isolating, which means your entire household must isolate except for individuals who are fully vaccinated or considered to have immunity because they've had a positive test result in the last 90 days, or talking with a physician or a healthcare provider to get assessed and tested. Individuals who are fully vaccinated and have symptoms not related to a known condition must also self-isolate and get tested. Some people may experience COVID-19 vaccine side effects 48 hours after receiving their vaccine. You can go to school or childcare if you or anyone in your household received a COVID-19 vaccine in the last 48 hours and are experiencing any of these symptoms that are mild and only began after vaccination. The Ministry of Health may direct school boards and schools to perform daily on-site confirmation of self-screening, such as during a period of potential higher transmission, for example, after a holiday period. School boards will have a process in place to implement on-site confirmation of self-screening of individuals if required. As I mentioned, the ministry is in the process of shortening the symptom list on the screening tool. There's not one specific measure that will prevent transmission from occurring in schools, but a combination of elements that contribute to making schools healthier spaces to work and learn. Masking and screening are only two examples of protective strategies schools are expected to implement. Another strategy to be used in combination with masking and screening is physical distancing. Public health encourages as much distance as possible between students, between students and staff, and between staff members. Physical distancing measures are then to be layered with other public health measures, such as hand hygiene, cohorting, and enhanced cleaning. The more measures we put in place, the lower the risk will be. These measures will help keep our schools open. Students will need to be tested for COVID-19 if they are experiencing new or worsening symptoms of COVID-19 and no alternate diagnosis has been provided by their primary care provider, or if they've been identified as having a high-risk exposure for COVID-19. This applies to people who have been vaccinated and are not vaccinated yet. Public Health will provide guidance to cohorts that have been identified to have a high-risk exposure. This guidance will include when and where to get tested. Currently, testing for when you meet the two criteria shown on the slide is only available at our local assessment centers located in our hospitals. In the previous school year, school-based asymptomatic testing was available to students, children, and staff who were not showing symptoms and had not been identified as close contacts of COVID-19. And this testing was provided either at participating schools or through pharmacies. However, this program ended on June the 30th, 2021. We are currently awaiting further guidance from the ministry on whether this program will be available to staff and students this year in Halton. So let's talk a little bit about case management and contact tracing. When there's a COVID-19 case at a school, Halton Region Public Health will follow the most current Ministry of Health COVID-19 guidance for school case, contact, and outbreak management. Halton Region Public Health notifies the school, investigates whether others at the school are impacted, and identifies any others who will need to be contacted and possibly tested. Once our investigation is complete, we provide direction for the affected cohorts and the teachers. An outbreak is declared if there are 2 or more confirmed cases and at least 1 case could have been acquired in the school setting within a 14-day period. Public Health will conduct a risk assessment and investigate where the outbreak exists within the school. The outbreak will be posted on Halton's web page dashboard after communication has gone out to the local school community. Our staff will work with schools every step of the way throughout the process. If a class cohort is dismissed based on the risk assessment, vaccination status of individuals will be taken into consideration along with other information such as duration and location of exposure and the PPE worn. Generally speaking, someone who's fully vaccinated or considered to have immunity does not have to isolate after a high-risk exposure to a case of COVID-19. They will be directed, however, to get tested and monitor for symptoms. However, there may be situations when fully vaccinated individuals will be directed to self-isolate after a high-risk exposure. For example, where a strain of the virus that is known to cause more breakthrough cases, that is, cases in fully vaccinated individuals, has been identified. And we have had this happen here in Halton. Halton Region Public Health also has staff working in many areas across the COVID-19 response to support our schools and families during, including the 311 call center or Access Halton, as well as our public health call center. The uncertainty of the pandemic combined with the more common back to school nervousness is a lot to manage. So I encourage you all to talk to your children about how they're feeling about going back to school. Listen to what they have to say and reach out for help if you need it. We have developed 6 short animated videos on common public health measures to help you review these tips. They can be found on our COVID-19 school and childcare information webpage. I'll now take a few minutes to talk about vaccination, including our youth vaccination strategy. To be fully vaccinated, students must have received 2 doses of the Pfizer vaccine, which is currently the only vaccine authorized for individuals under the age of 18. Being fully vaccinated not only protects children and youth against COVID-19, but also helps prevent the virus from spreading to those who may be at greater risk of serious illness. As of last week, All Halton youth born in 2009 or earlier that live or attend school in Halton can get their COVID vaccines through any of our walk-in community clinics. Appointments for youth are also available at participating pharmacies and primary care offices. These appointments must be booked directly through the pharmacy or your primary care office. Visit covid19.ontario.ca for more information on participating locations. Vaccines work. For cases reported in June to August among 12 to 17-year-olds in Halton, 100% were among the unvaccinated or those who had only received one dose. The most recent data shows that the COVID-19 vaccination rates amongst 12 to 17-year-olds who had received their first dose was 87% and 77% for those who have received both doses. Milton is outpacing the rest of the community with over 90% of this age group with one dose and 80% with two doses. Go Milton! While this is extremely encouraging, I think we can do better. It's critical that we have a very high vaccination rate, as close to 100% as we can get it. Some people feel worried that the vaccine was developed very quickly. The vaccine was developed so quickly because the science behind these vaccines was already established before COVID-19. No steps were skipped in the process of developing, testing, approving, and producing the vaccine. They were produced faster than usual because of never before seen levels of collaboration and funding from around the world invested in this effort. Clinical trials also had quick access to a large pool of study participants. Many people have been safely vaccinated all over the world. The benefits of vaccination outweigh the risk of getting severe COVID-19 illness. Although rare, there may be long-term complications from COVID-19 affecting multiple organ systems. Long-term effects can include memory loss, fatigue, body aches, unexplained breathing difficulties, and damage to your lungs and heart. Some of the people with long-term symptoms from COVID-19 infection are young and healthy, unfortunately. Clinics have been set up to support the many COVID-19 patients who, although they are no longer infected, cannot go back to work or live a normal life because of these long-lasting symptoms. Vaccination not only protects against this, but severe side effects from vaccines are very rare. During the past school year, 71% of cases among children aged 0 to 11 were household exposures, meaning they became infected by someone in their household. We can protect members of our community who cannot be vaccinated, including children under the age of 12, by having a large proportion of the eligible population fully vaccinated. By receiving the vaccine, you are much less likely to become sick. And if you do become sick with COVID-19, you are less likely to spread the virus. Young families may be concerned about vaccination because they've heard that it can affect fertility or it's not safe during breastfeeding. This is not true. When vaccines were first available in Canada, pregnant people were advised against receiving the vaccine because they had been excluded from the early vaccine studies. Now we have more data from within Canada and around the world that the COVID-19 vaccines are safe and effective in pregnant and breastfeeding women. In fact, leading experts like the Society of Obstetricians and Gynecologists of Canada recommend getting both doses of COVID-19 vaccines if you are planning a pregnancy or if you are already pregnant or breastfeeding. If you're thinking of becoming pregnant or are pregnant, getting the vaccine as soon as possible is also the best way to protect yourself. Pregnant people with COVID-19 infection are at higher risk of hospitalization and admission to the ICU than non-pregnant people of the same age. So let's shift gears a little bit and not talk about COVID. Routine vaccinations are also important. It's important that parents look at their child's immunization card and ensure that they are up to date on all of their regular immunizations. Ages to remember for these vaccines are generally between the ages of 4 to 6 and 14 to 16 when you require a booster shot. If you're unsure, find out from your family doctor and make sure you get your child immunized as soon as possible. I also want to let parents know that the Immunization of School Pupils Act, requiring all families with children attending school in Ontario to provide public health with a record of their child's immunization, will not be enforced during the 2021-2022 school year. This means we will not be using the potential of suspensions this year for those students whose immunization is not updated. We will continue to send reminder notices to urge you gently to update the records with us in time for the next school year. Please remember, it is the parent or guardian's responsibility to report all routine immunizations using Halton Region's online immunization reporting tool. Go to halton.ca/immunize to use this tool. Please do not report COVID vaccines through this online tool. If your child received a COVID-19 vaccine in Ontario, it is already recorded in the province's COVID-19 immunization database called COVAX, and you do not need to submit additional proof at this time. There have been many disruptions to routine school vaccination clinics offering vaccines against hepatitis B, HPV, and meningitis due to the COVID-19 related school closures. This year, Halton Region will be running new community clinics for school-based immunizations that were missed or upcoming. This chart shows the vaccines and the birth year and grades that will be eligible to book appointments this fall. All of this information will be available on halton.ca/immunize, and we will ensure to communicate with you in September via your school about how to book appointments if your child is eligible. We are making arrangements to have clinics in each municipality during hours outside of school hours so as not to cause any disruption to learning. At one point or another, you may feel worried about your child's mental health and wonder where to go to for help. This is natural. At school, students and parents or guardians can speak to their teacher or other trusted staff person, such as a child and youth counselor or social worker. The school board website and the mental health page at halton.ca/mental health both have tips, resources, and lists of local organizations that you can easily access. Our Halton Parents Public Health nurses are also available to provide mental health support and help connect you with community supports. So as I mentioned, one of Public Health's excellent services for children and families is Halton Parents. If you have any parenting questions, from the early years of toddler tantrums to the teen years, remember, our Halton Parents Public Health nurses and dietitians are here for you. Connect with us on social media, through email, or by calling 311. We also have many helpful back to school blogs to read and live discussions happening on Facebook. As always, I would like to remind you of the importance of following certain public health measures. Returning safely to school is a community effort based on individual actions, and we all have a role to play in helping to keep our numbers low. This means that we are counting on you to get vaccinated if you were born in 2009 or earlier, practice lots of physical distancing, wear a mask in indoor public places and outdoors when physical distancing cannot be maintained, complete the COVID-19 screening tool daily, follow good hand hygiene and cover your coughs and sneezes, get tested if you have one or more symptoms of COVID-19, and stay home when ill, even if you have very mild symptoms. It is everyone's responsibility to ensure that we continue to follow these measures both in and out of schools to keep our children, staff, and families safe.